Good evening and very welcome here. Today we are going to discuss the case note of Nicole Smith, an 18-year-old mother who is finding it difficult to care her baby, who was born just 3 days ago. And we are writing this letter to the Director, Community Child Health Service, Vulture Street, Western Brisbane. And the purpose of this letter is to request a home visit to provide Miss Nicole Smith and provide Miss Nicole Smith with advice and assistance for parental care. So this is the summary of what we are going to see today. So we are going to write to seek assistance for Miss Nicole Smith to help her overcome with some conditions. And condition number one is she's not confident in carrying the baby, in feeding the baby, in bathing the baby, in caring the baby. And she's often confused whether she can be a good mother. She is asking concerns whether she can adopt her baby, can give her baby for adoption. So this is what the condition is. Let's go and see the question in detail. So we have reached the first page. Now, yeah, this is an 18-year-old baby, 18-year-old woman who has given birth to her first baby at Spirit's Mother's Hospital, and you are a nurse looking after her. So you are a nurse looking after Miss Nicole Smith. So she is a single parent here. Let's see. The address is given. Date of birth is given 4 September 1991. Admission date, discharge age, marital status single. Now, Nicole has no contact with the father of the child for 6 months, so she has no contact with her parents or sister who live in Rockhampton. So, so that is the first difficulty that she has. Now, the second is the accommodation. She is not living in her own house. She is living in a shared accommodation with another woman. Now, but the only benefit what we have here is that she receives sole parent benefits. Now, her psychological difficulty is very clearly stated there: isolated and insecure, and doubts her ability to be a good mother, as talked about offering the baby for adoption. So she doubts herself whether she can be a good mother. So she is thinking of adopting her, giving her baby for adoption. So we don't have any significant medical history here, no social history, no smoking, no alcohol, no drug. So this is her first pregnancy, and those things are clear, no problem. Now we have the birth details, and she had some problem here. The problem was fetal distress and failure to progress, and she was subjected for emergency cesarean section for delivery. The baby was born with a 4.4 kilo weight and with an UPGAR score, good UPGAR score. So just a minute. Got some problem here again. Yep. Sorted. Now, let's move further. Now, we have another problem here. After the surgery, she got postpartum hemorrhage, and she had her hemoglobin level falling from the normal to 90 gram per liter. So she was supplemented with vitamin C and Fayfol. That's the iron supplement. That were the medications that we have started here. Now, we started breastfeeding as normal, but she's not so confident. She prefers changing it to bottle feeding. So, and she's not confident in bathing and caring of baby. So the baby's weight, it was 4.4 kilo at the time of birth. In 2 days, it was on 10th of this month. And this is 13th. that the date of discharge. In just 2 days, the baby's weight fell by around 200 grams, but he's otherwise normal, feeding well, no jaundice. So this is the letter. We don't have any significant data to be looked into or any complications here. We can go to the sample letter here. The Director, Community Child Health Service. Dear Sir or Madam, because we don't know the name. Reference Miss Nicole Smith, aged 18. So let's go ahead. I'm writing to request a home visit for Miss Nicole Smith, who is isolated, insecure, and non-confident in caring her 3-day-old male baby. So the reason why I've stated this purpose is I need to give information very straight to the reader of the letter. So what is the request? The request is a home visit. For whom? Nicole Smith. And what is her problem here? I don't have any specific diagnosis here. It's not pregnancy related problems. It's not a feeding problem. Yeah, we have to consolidate. We need to summarize the letter, and we need to find out what is the reason why we are writing this letter to the district nurse. Though we are writing to seek the service of this director because Nicole Smith is isolated. She doesn't have contacts with her the father of the baby. She doesn't have contact with her parents or her sister, and she's insecure. You know that she lives in a shared accommodation with another woman. She is not financially that much independent, even though she receives some sole parent benefit. It's not that much secure. So she doesn't have her own house, her own income, all these things. No, and she's non-confident in caring her 3-day-old male baby. So this is what the reference for the baby is. We don't have the name. That's why we have not written the name. So 3-day-old male baby states it all very clear. And the problem here is non-confident in caring in the sense feeding, caring, bathing, everything. So we have briefed everything in this thing here. After her admission in the evening of 9 September 2009, due to fetal distress and failure to progress, Miss Nicole has undergone an emergency cesarean section to deliver her first baby. So this is the first baby. So this the reason why she has undergone the emergency cesarean section is because she had fetal distress and failure to progress. So this was the difficulty she faced, and this is the reason why she had to go with the emergency cesarean section. Post-operatively, she was commenced on FEFOL and vitamin C because of a fall in her hemoglobin level secondary to postpartum hemorrhage. So we are just stating the medicines here, what she started. She's on FEFOL and vitamin C. So just to inform the district nurse that she has some supplements because she has a HB level falling. And all this information, these are relevant information which has to be informed. So we informed the district nurse that these things are done. Even though the baby was seen feeding well, Miss Nicole was less confident to feed, bathe, and care. Now, even though the baby was seen feeding well, so we started feeding, we can see the baby feeding well, Miss Nicole was less confident. The problem is not with the breast milk or the baby's ability to suck. It is the problem with the mother, because she is less confident to feed him. She's less confident to bathe him. She's less confident to care him. So this is what this is. So to feed, to bathe, and to care. So we have highlighted the problem here. Now, just 2 days after birth, the baby's weight fell from 4.4 kg to 4.1 kg. No, we just set a time parameter there in 2 days after birth. So 10th was his birthday, 11, 12. So now it is 30. So just in 2 days, we recorded the weight. At the time of discharge, it was 4.1. So this is something which is a significant parameter of improper care. So this is an indication that the baby is not well cared, or the baby is not well fed properly because of non-confident mother. Apart from that, she expressed her preference to give the baby for adoption. So this is where we presented the problems here. Now, regarding her social history, she lives in a shared accommodation with another woman, because we are writing to the director of the community child care, and we are requesting them the home visit. So I need to tell how she lives and where she lives. So she lives with another woman in a shared accommodation and has no contacts with either her baby's brother, baby's father, or her own relatives who live in Rockhampton. So we are giving indirect information that the mother of the baby has relatives in Rockhampton, but she has no contacts. So because why we have written here this thing is because of this intervention. Maybe this district nurse can establish some contacts with her own parents or sister who lives in Rockhampton. So there is a possibility there. That's the reason why we have written Rockhampton, the place name there. And we have stated there. So we have to say the difficulty. This is a difficulty if with the support of this community health nurse or district health nurse, if she is able to make contacts with her partner or with her parents or sister, that would be relieving her insecurity feeling, that would be relieving her that would be giving her a boost in her confidence to care her baby. So that's the reason why we have mentioned the place where the parents of Nicole's, where they live. However, she receives sole parent benefits now. And despite these difficulties, she receives sole parents benefits now. That's the last sentence there. Now, it would be appreciated if you could arrange a home visit for her. Now, for Miss Nicole, in order to provide her advice to tackle the situation, along with offering her and her baby with support and assistance. So that's a closing. It would be appreciated if you could arrange a home visit for Miss Nicole in order to provide her advice to tackle the situation. I need a punctuation here, along with offering her and her baby with support and assistance. Yours faithfully, Nurse Pated Mothers Hospital. So I hope this letter finds you comfortable. Hope to see you soon with another letter. Till then, bye.